I'm Sheena. Everyone here probably recognizes me with Uncommon Sense Investing. And I invited Dave Bomkamp, a Medicare specialist, to come talk a little bit about Medicare. I first got to know Dave. I was finding myself in a place where I needed to learn more about Medicare because certainly I get a lot of questions about that in the retirement planning process for clients. And so I went to one of Dave's sessions. He'll give educational sessions down at the Hedberg Public Library. And I listened to his educational content that was really quite good. And I also got a really good vibe from him, just a great personality, very kind, very helpful, really above and beyond in terms of how he works with people. And so I really found Dave to be a resource for me, and it's been great to get to know him. So he was so kind to come here and talk about Medicare through this webinar, and we are recording it. So we'll be sending out the recording along with some supplemental material for you after the fact. But really, I'm just here to be a fly on the wall and to do a little bit of facilitating. So I'm going to turn the floor over to Dave at this point. Thank you, Dave.
All right, thank you, Sheena. I appreciate, again, the opportunity to meet with all of you today. Again, my name is Dave Bomkamp. I am a field trainer and agent. My main company, of course, is Physicians Mutual. I look forward to walking you through as we go along. If you have questions, there's no dumb questions. We're going to cover a lot of things. If something, we'll cover at a later point in the slides. I'll let you know, and we'll cover that at that point. But if you ask something that's pertinent to the slide that we're on, I'll be more than happy to answer that. And of course, I will stick around after the presentation is done to answer any questions. So
just one piece of advice for anyone who's not totally familiar with Zoom and Zoom webinar. In order to answer a question, that question and answer box is at the bottom of your screen where there's a few tools. So just click on that question and answer box and you can type in your question and we'll answer that verbally.
Okay. Fantastic. All right. Well, here's the first slide for most of you that we're speaking with today. You're in the baby boomer generation, as you're all aware. These are just some numbers that are kind of interesting. I'm into numbers. About 2.3 million people turned 65 this year, so you are not alone in this journey. The fact that you showed up today really points out to me that you care to be educated. Those of you that are educated, it's much more difficult to have someone pull the wool over your eyes, if you will. There's lots of people calling you. I'm sure you're getting lots of things in the mail, and you were one of 2.3. This number remains steady for a couple more years. It will start to level out at about 3 years from now, and then it'll start to decline eventually. But again, you are not alone here. Just a little bit about Physicians Mutual, the company I work for. We've been around since 1902, so more than 120 years. You'd be hard pressed to find a company that's been around longer than us. We've been in the Medicare supplement business for over 50 years, so this is nothing new to us. Personally, myself, I'm working on my 8th year with the company. Best company out there. I do represent other companies, but by far, Physicians Mutual is the best and the one that I really stand behind. We have an A+ rating. We are the only company in the state of Wisconsin that has A or better rating. And why that's important to you, it keeps your premiums down, and it tells you we're not going to go out of business anytime soon. So that's a little bit about the background. We are based out of Omaha, Nebraska, so we're a Midwest company. All right, so that's enough about Physicians Mutual. Here's what we're going to chat about today. We're going to talk about transitioning from employee to retiree, which is where some of you are. How to enroll in Medicare, what are the different parts of Medicare? Probably the most important reason most of you are here today is figure that all out. And how do you pay for your health care when you're retired? And if I go too slow or too fast, please just let us know through the chat and I will adjust accordingly. What is Medicare? Medicare and Medicaid are two different situations. Medicare is a federal health insurance for seniors and people that are disabled, essentially. Medicaid, this is a state-federal partnership for people that are on limited income. They are not one and the same. They are completely separate. Some people have both of those. I'm not super familiar with Medicaid. Up to a certain level I am, but if you have Medicaid, there are certain situations that are different than people on Medicare. Okay. All right, some basics about Medicare. Started in 1965 and run by CMS. This is fairly important. CMS stands for Center for Medicare and Medicaid Services. When you get this in your mail, this is not junk mail. This is your Medicare card. This is all your explanation of benefit statements. Any correspondence that you receive from Medicare comes through CMS. That's what will be on the envelope. So don't forget that one. Mostly for seniors, the MMA Modernization Act 2003. I wasn't in the business back then, so I couldn't really speak too strongly on that. The ACA, this is the Obamacare Act, if you will. Back in 2010, there were some changes that were made that took effect in January 2020, and I will explain that in more depth when we get to it. Some of this information down below, we're going to have some handouts for you, electronic handouts to give to you at the end of the presentation if you want them. Okay. Okay, what am I eligible for Medicare? Can I start when I go on Social Security? What are my early retirement options? But more likely, what happens if I work past 65? That seems to be the more common thread these days. And if I go on Medicare, what happens to my spouse? All right, signing up for Social Security benefits or Medicare benefits are one and the same. socialsecurity.gov. Now, I'm imagining that some of you here have created a My Social Security account. You can enroll in Medicare through that portal. If you need help with that, I'll be more than happy to walk you through that or send you an electronic form and the process to follow. That's the easiest way. It only takes you about 15, 20 minutes. Or you can do the 1-800-772-1213. That's directly to the Social Security Administration. They will enroll you in Medicare and Social Security if you decide you want Social Security. They will set up a telephone appointment for you at a future date. It won't be the day you call, but they will call you at the appointed time to help you with your enrollment. Apply in person at your local Social Security office. I would not do that. The Janesville office will not help you. Unfortunately, things have changed since COVID. They want you to do everything online. I think you can make appointments for certain things, but I don't believe that helping you enroll in Medicare is one of those. And it says to be sure, have all this information. Quite frankly, most of this information below is really not necessary unless you're a naturalized citizen. When you create the Social Security account online, they're going to do a verification, so you most likely won't need to show any of this information. Okay, so socialsecurity.gov is certainly my easiest way to enroll in Medicare. All right, should I enroll in Medicare? Now, if you or your spouse are currently working and receive your health insurance through an employer, you must check to see with them how your insurance will work with Medicare. So let's say that you're working and you don't want your Medicare yet, and you're on your group insurance at work. Check with your HR person to see how your insurance may or may not change when you turn 65. Same thing goes if you decide to retire and you're on your spouse's insurance. Have your spouse check with their insurance to see how you'll be treated underneath them. Okay. Now, if you work for an employer of less than 20 employees, Medicare will be your primary insurance. So if you work for a small employer, you need to check and see how that will react. But again, that is important to know. Because the second bullet point, when you retire, you will have a special opportunity to enroll in Medicare without penalty. So even though you don't take it at 65 and you remain on a group plan, you will get a second opportunity, which we'll cover more in depth shortly here. Do I need coverage for my spouse and family? This is important. There is no family plan, if you will, under Medicare. It is a one-on-one situation. If you qualify, you're enabled to get it. If your spouse does not, they will not be able to get qualified unless either A, they're 65 or they get covered through Medicaid. Okay. Signing up for Part A. If you are taking your Social Security, you are going to be automatically enrolled in Part A and automatically enrolled in Part B. Okay, so for most of you, you need to enroll in A, even if you remain on your group insurance. That part you will still need to do around the time you turn 65. Most of you will pay no premium for Part A. That's been prepaid for you, provided you work 10 years over your working career. That's already been deducted from your FICA taxes. If you look on your check, FICA, part of that was Medicare, part of that Social Security. Most of you prepaid that. And again, if you're not taking Social Security, you need to take your Part A if you're remaining on your group insurance as well. Okay. There are 3 separate times that you can enroll in Medicare. If you don't need to sign up for pay, you can do one of these enrolling times. Initial enrollment period, we call it the IEP. That is traditional Medicare. This is the time 3 months before your birth month, the month of your 65th birthday, and 2 months past that. So you have a 6-month window. That's called your initial enrollment period. Let's say this is traditional retirement at 65. You want to retire at 65. You can enroll 3 months before your birthday. So let's say your birthday is in January. October, you can enroll October 1st and beyond, you can enroll. And you can enroll to the end of February. Excuse me. Yeah, end of February. Excuse me, end of February. So you have 6-month open enrollment period. That is your IEP. Now the special enrollment period, I'm going to jump down one. The special enrollment period is, let's say you're at 65, you decided to stay on group insurance or work later, whatever the case is. All right, now let's say you're 69 years old, you got full retirement coming. Now you decide that you want to retire. This is called the special enrollment period. You got the same opportunity you did during the initial enrollment period if you didn't take your Part B. Let's say you enrolled in Part A like you're supposed to have at 65. Now you're 69 years old. This is called your special enrollment period. The same situation applies 3 months before your birth month and 2 months past that. So that's the same thing as initial. Now the general enrollment period, this is for folks that miss the enrollment period. So let's say you retired and you went more than 63 days without insurance. I had a client that did this. They retired, they got in their fifth wheel and disappeared for 3 months. Well, when you go more than 60 days without any health insurance or being enrolled in Medicare, there's a penalty there. And that's the one you do not want to be in. So an important thing to know is as soon as your group insurance ends, the very next day, your Medicare should be kicking in and you won't have that issue. But that's the general enrollment period. So those are the 3 initial things to enroll. Now, if anybody has any questions, please let Sheena know, because this is super important, as when your enrollment periods are. Okay. Okay. Signing up for Part B. Again, if you're taking Social Security, you'll automatically be enrolled in Part B the first month of the month you turn 65. So unless your birthday is on the first of the month, so my birthday is January 14th. January 1st will be my Medicare date when I get there. If your birth month, let's just say you happen to be January 1st, well, you're going to start in December. So if anybody out there, their birthday's on the first of the month, you will start 1 month previous, and that's important to know when you're enrolling. That is your open enrollment for Medigap insurance. If you don't want Part B, follow the instructions that come in the back of your card and send the card back. So let's say you're on Social Security, they're going to send you a card with A and B on it. If you are staying on your group insurance, either yourself or your spouse, you're going to want to cancel the Part B for 2 reasons. First of all, it comes with a premium. There is a premium for Part B, and you don't want to be paying that if you're not going to be on insurance, because you're already paying for insurance. The second reason to do that, there's also called guaranteed insurability. You want to make sure that you have the ability to join even if your Medicare, your health changes. And by not starting Part B, that keeps that all in place. So most of you are going to pay $174 a month, and that's what you would pay if you don't disenroll. So it says follow the instructions to come back in the card. Here's what I would advise you to do. Take the card down to the Janesville Social Security office if you don't want Part B. Hand the card to one of the clerks. Take note of the day, time, and who you gave the card to, and tell them, please, I don't need Part B right now. I'm staying on my group insurance. Okay. And once you do that, they're going to start that off again. So any questions on that, let me know. But that's the easiest thing to do if you don't want it. Okay, again, if you didn't start Part B at initial enrollment period, there's the other 2 periods. Again, you have 6-month open Medigap open enrollment period, which means you have a guaranteed right to buy Medigap insurance. So that's super important. That's why we don't start Part B until we need it, because that's guaranteed issue, meaning you can have, let's say you work at a 65, you didn't retire, you're going to 70. All of a sudden in between there, you develop cancer or something significant, you still have guaranteed right to buy any insurance you want. So you don't lose that ability. Okay. Part B premiums. Now, Part A is, for most of you, will be free, if you will, because you prepaid that. Part B does come with a premium. Okay, for most of you there, you can look at the corresponding income levels and what your premium would be. For most of you, I assume 103,000 for an individual or 206, your premium is going to be 174.70 a month. Now that will change January 1st, but that's what it is today. Okay. Now, if you make more, you can see down below what your corresponding premium is going to be. And Sheena would know I spoke with her dad about this. This is Uncle Irma or Aunt Irma. You're going to pay a little bit more for your Part B premium, and you're going to pay a little bit more for your drug plan as well. In That's more of a conversation for some of you that are in the second and third and fourth quartiles. We could have an explanation to you a little bit more in depth on what this all means to you. But for most of you, 174.70 will be your Part B premium. Okay, everybody on Medicare pays that. Now, the important thing to know with this, one more thing on this, and we'll move on, is the 174.70 will come out of your Social Security check if you're taking Social Security. If you are not taking Social Security and you still want Medicare, you can do that, but they will bill you quarterly for that premium. Okay. Just give me a second. I got to shut my window here.
I'm just going to pipe in for a moment and mention that this is looked at annually. So if you happen to have a high income year, that high income year, you'll end up paying IRMA for 1 year. And then say the following year, if your income goes back to what your normal level is, then your premium will go back down to what it would correspond with in the income chart. So your premium will change annually if your income fluctuates.
Good one. They do look back 2 years on this. So some of you, your highest earning years were probably the last 2 years that you worked for some of you. Now, if you're in one of these other quartiles, they, like Sheena said, they do adjust this annually. So it may take some of you 2 years to get out, or maybe you go from one level to another once your income is done and you're starting to survive on your investments or your pension or whatever the case is. But again, they will adjust that. It's called IRMA. And that's a kind of a more important conversation for those of you that are at the higher end. But just know that they do adjust it for you. So this is not necessarily set in stone. And these numbers do go up each year.
Hey,
Again,
Dave, I've got a question in the
sure,
question box. It actually
sure.
has to do with the previous slide. But the question is, if you turn your card in and say that you don't want your Part B, then when you want it because your group insurance is ending, do you enroll online and CMS issues you a new card?
That's a good question. I always tell my clients and potential clients, you probably want to do that 90 days before you need it. So let's say you're targeting January retirement. You want to get that process going in October for a January start. It's going to take you 30 to 60 days to get the card, and then you're done. That's why we do 90 days. So if there's any hiccups along the way, you have 30 days to work those out. But good question. When you identify the date, now you can do it shorter than that. Medicare, you call Medicare and say you got 30 days. They'll backdate it sometimes, but you're really pressing it to get your get your cards in time. So it's important to make sure that you have a little visibility if you can, but again, 90 days is ideal. Good question. Did that answer the question for them?
Yeah, I think so.
Okay. Good question. So we'll move on. All right. If there's no more question on income, we'll move to the, I call this the alphabet soup. Okay. This is alphabet soup of Medicare. We're going to talk about the different parts of Medicare, and I'm going to give you a quick rundown on this, but A, B, C, D, we're going to go more in depth into each of these, but the original breakdown is Part A is your hospital insurance. But the easiest way to think of Part A is think of beds. You have a hospital bed, skilled nursing facility, short stay at a nursing home less than 30 days, home health care, and hospice. So any place you stay overnight under Medicare, that's what Part A pays for. It's your room charge. It's the bed you're sleeping in, the TV that they give you, the food they bring you, the lights in the room, everything else. Okay, that's your hospital insurance. That's what it pays for. Part B is your medical insurance. This is probably the more common part that you'll become used to. This is your doctor bills or any kind of specialist you may see, all your laboratories, all your surgeries, all your durable medical equipment, your CPAP machine, those kind of things. Diabetic test supplies, physical and occupational therapy. Pretty much, if it's not a room or drugs, it pretty much falls under Part B. So Part B is a big umbrella. Okay, so between the hospital insurance paying for the room and the Part B paying for all your surgeries and labs, that's your health insurance. That's called original Medicare. So if you heard anybody tell you I have original Medicare, that's what it means. They have Part A and B. Pretty easy. Part C are the Advantage plans, and we'll cover those a little bit more in depth here in a little bit. Part D, D for drugs. And we're going to, of course, cover that as well. Because whether you're in an Advantage or a supplemental, you're still going to need drug coverage. Okay. So we're going to go each and break these down more depth than we have here, but that's the outline of it. Okay, the healthcare pie. Sheena, I'll get this one to you. I forgot to include this one, but I'll get this one to you. Really, what the healthcare pie is a diagram that shows you the different parts of Medicare and the parts are covered by different Medicare A, B, C, and D, right? They're all going to be in here. It's divided in half. Chronic means reoccurring. I have a bad back. I've had a bad back for 30 years. That's a chronic need. Acute need, you fell off the ladder, you broke your arm, you need emergency care right away. And we'll start filling in this shade with the different parts of Medicare. Some of these will be left uncovered. These are all the various things that you may need to purchase in your retirement years that you get to decide which ones you want to purchase. And some of these will be left open in which place you'll need secondary insurance for those. And we'll get a little bit more in depth with that. And I'll make sure that you get this pie. Okay, for Medicare 2024, this is the first number that I'll throw at you today. The Part A deductible. The Part A deductible is $1,632. What does that mean? That means the minute that you're admitted to the hospital, you owe the hospital $1,632. Once that $1,632 has been met, then the Medicare pays the hospital for all your stay after that point. But that's a deductible you are responsible for. Now, not to fret too much. Most of you, of course, will probably have secondary insurance to help you cover that. But that's the number Medicare has. And again, in January 1st, that will change. And I'll bet you lunch it'll go up some, but that is the Part A deductible. So the 1632, it's important to know. So let's say you're in the hospital for 3 days, you pay the 1632, and then Medicare pays for the remainder of that time. Done. Now, the important thing is the 1632 is a reoccurring deductible. And it's good for 60 days. So let's say you paid the 1632, you're in the hospital for 3 days. 3 months from now, you went back in the hospital overnight again for some other thing, or maybe a reoccurrence of the first condition, you'll pay the 1632 again, even though you were just in the hospital a couple months earlier. So the important thing to know is not to memorize the 1632. It's to know that the Part A has a deductible because that number changes every year, but just know there's always a deductible and it resets every January 1st and it resets every 60 days. So if you paid your deductible in 61 days after the last time you paid it, if you go back in, it's due again. And again, that's what insurance is for. That's the important takeaway on this one. Okay, now we're going to talk about a second set of numbers. The next set of numbers we're going to talk about is hospital stays in most cases. Medicare will pay 100% for the first 60 days. So what does that mean, Dave? Each time you go in the hospital, you're going to pay your deductible. And then Medicare, each time you pay for your deductible, it'll pay 100% for the first 60 days. So let's say you're in the hospital for 3 days, like I mentioned here, you paid your deductible 3 days. 2 years from now, you go back in the hospital, you're there for 2 days. Now you're up to 5. These are lifetime days we're discussing here. The first 60 are covered 100% after you met your deductible. Okay. Now, if you're unfortunate enough to be in the hospital more than 60 days and the rest of your life here, the co-payment this year is $408 per day for days 61 through 90. All right. Medicare will pay all but that number, and your secondary insurance will help you with that. Now, if you're super unlucky and you start you've burnt up 90 days and you're day 91 through 150, these are your lifetime reserve days, meaning we're getting to the end here. That 408 doubles to 816 per day. Okay. And these are lifetime reserve days. Important to know. After 150 days, so day 151 and beyond, Medicare pays 0. Now, what we're referring to again is back to the first couple slides. All those rooms we discussed, the hospital bed, the skilled nursing facility, all those in aggregate together, not each, aggregate. If you spend 150 days, Medicare no longer cover those rooms for you. Okay. So important to know, though, to again give you a little bit of make you take a little bit of deep breath. Most insurance plans provide you additional days, but that's what Medicare gives you. Okay. So that is important to know. All right. Some of the other Part A data, we talked a little bit about skilled nursing facility. The biggest thing to know, the definition of you need a hospital stay of 3 days. And under Medicare's definition, a hospital stay starts at midnight. So if you happen to get admitted at 10 p.m., you've got 1 day down at midnight already. All right. And then you got to enter the skilled nursing facility within 30 days. And here's the definition. You need skilled nursing care 7 days a week or skilled therapy at least 5 days a week. So let's say 7 days a week, you're really totally unable to help take care of yourself. They need to help you every day of the week. Or 5 days a week, maybe you're doing a rehab assignment after a light stroke or something and you just need help ambulating. And they only do that Monday through Friday in most cases. Okay, so that's what skilled nursing care generally is. Medicare pays 100% of skilled nursing facility for the first 1 through 20 days. So the first 20 days, Medicare pays for that facility. Now, days 21 through 100, your secondary insurance will help you with that. And again, but there's a copay of $204 per day, and that's what the insurance would help you with. After 100 days, Medicare or your secondary insurance is not going to cover. It's $0 for after 100 days. So meaning they're going to discharge you, or you'll be doing private pay after that point. Okay. All right. Any questions on that? Let us know. Additional Part A benefits, blood, which is one of the ones I didn't mention. Yeah, go ahead.
Dave, I do have a question that popped in.
Sure.
When you are hospitalized, does Medicare cover every expense, like surgeries, x-rays, physician charges?
Most of those are covered under Part B.
Just
That's
the daily
correct.
cost of the room?
Well, the daily cost of the room falls under A, and your Part B, which we'll cover here shortly, would cover the doctor's bills, the x-rays, the labs, and all the other things. That's correct. Yes.
Thank you.
Mm-hmm. To wrap up Part A, blood I didn't mention at the beginning. The reason that blood is under Part A, because that's always an inpatient thing. You're never going to get blood as an outpatient. Believe it or not, Medicare does not pay for the first 3 pints, which are the most important pints you'll ever get. Your secondary insurance will help you with that. Home health care, and at the end of life, hospice. Actually, Medicare does a pretty good job of hospice in the whole. So Part A, that is your main parts of Part A. All right, now we're going to show you this healthcare pie here. Okay, you can see hospice is shaded in nursing home, skilled nursing, home healthcare, and hospital stay. So we're starting to fill in this pie a little bit. Again, you'll get a copy of this. All right, that's it for Part A. Does anybody have any questions for Sheena for Part A? Otherwise, we'll move on to Part B. Okay, what we'll do is we'll move on to Part B. Part B, this is your medical service. This is what is your medical benefits? Welcome to Medicare visit. We'll kind of explain what that is in a minute. All your preventative services, inpatient, outpatient surgery supplies, speech and physical therapy, all your diagnostic tests, your MRIs, your CT scans, all those things, CTs, durable medical equipment, CPAP machine, those sorts of things. Ambulance services. This is something most people aren't aware of. So let's say the ambulance comes to your home to take you to the hospital, not to fret. That's going to be covered under Part B. What are some of the preventative services that are under Medicare Part B? This is a welcome to Medicare visit. What's that, Dave? Anytime the first year that you're on Medicare, the first 12 months, you can go at any point that you want. It's a one-time review of your health. You get education and counseling. Again, you go anytime the first 12 months, but it's important to know this is not a physical exam. This is going to be a 15 to 20-minute visit. You don't have to go to a special doctor. Your normal doctor you've seen all these years will take you in for this. However, most likely will be shorter than the visit that you probably had with your group insurance, because of the fact that Medicare doesn't pay these doctors a whole lot to provide this for you. So most likely they're going to shorten it. But again, it's not a physical exam. Just important to know. After the first year, it's known as a wellness visit. So this is an important term, wellness. So each year when you go in, When you're scheduling your annual visit with your doctor, say you want your wellness visit, a couple things is important to know about this. It's provided free once every 12 months. It's not subject to any deductible, so it's a free visit under Medicare. So, and usually it's just to go to renew your medications or a simple check-in. When you're booking the visit, if you mention wellness, they'll know not to bill you for that. And it's again, when we talked about the welcome to Medicare visit, their wellness visit each year is really just to kind of follow up on the plan that you developed the first time. So let's say you're diabetic, those sorts of things, they'll follow up with you, see how you're doing with your weight loss, whatever the case is. And again, it's not a physical exam. That is a whole different thing. So that is your basic checkups under Medicare. Again, it's mostly a med check. All right, some of the preventative things that Medicare takes care of: aortic aneurysm screenings. One time only. This is something you probably want to do more often than one time, but Medicare will cover that one time. Mammogram. So for you ladies out there, you still get your yearly mammogram. Blood tests. It says once every 5 years. This is a little bit deceiving because some of you that are taking the statin drug, perhaps, some of you that are taking blood thinners or other medications that need blood monitoring, this doesn't apply to you. This is just for someone that maybe doesn't have any blood issues and they just want to check where their lipids are or sugars every couple of years. But for those of you that need it for a medication, you can get it more often. Colonoscopy once every 10 years. Again, for some of you that are declared high risk, you can get it at 2 to 3 years, depending on what your doctor orders for. Maybe the last time they checked you out, you have polyps and your doctor wants to see you more often. Medicare will pay for that, provided your doctor follows the rules. Okay. It's also important to know, this is another thing that's not on the slide that just history has taught me through my various clients, colonoscopy. So let's say you had a colonoscopy at age 60 through your work. Okay. You're 65, now you're going to Medicare. Hey, I can get another colonoscopy. Not that you really want to, but you could do that. Medicare says they'll pay for one every 10 years. If you just had one 5 years ago with your employer, they will not pay for that until you're ready for your next one. So you won't get one till 70 if you took it to 60. Okay. So even though it was paid under private pay when you join Medicare, it doesn't start all over. It's from the last one that you had. So be aware of that. Flu shots once per flu season. Medicare does covers flu shots and the COVID shots. All of your other vaccinations, your RSV, your Shingrix, your shingles shot, all those, your Boosterix, all those various sorts of things will be paid for under your Part D plan. Medicare pays for flu shots. That's pretty much it, except for the COVID. Okay, so those will be covered. We'll cover that more in depth in a minute when we get to the drug plans. All right, now we talked about the Medicare Part A deductible earlier. Now we're going to discuss the Medicare Part B. Medicare Part B also has a deductible, and it's $240 for this year. Now, this goes all the way back to the very beginning of the program when I said that there was a change to the ACA back in 2010. This is it. For some of you, let me break this the other way. Most of you will pay a $240 deductible each year with your insurance, no matter what kind of insurance you have. If any of you had started Medicare before December of 2019 of December or earlier, your insurance can actually pay for this for you and pay 100% of everything. Those of you that started Medicare of January of 2020 or later, which probably most of you are, you will pay the first $240 of the year before your insurance can kick in. Okay. That's what that slide alluded to at the beginning. Now, after you pay the $240, now this number resets every January 1st, important to know. So let's say you start Medicare in November and you have a treatment or something, you pay the first $240, January 1st, it's going to reset for you. Everybody in Medicare gets a new Part A deductible and Part B deductible every January 1st, no matter when you used it. Okay. And if you don't go to the doctor for anything, you don't pay it. Once you paid the $240, Medicare B becomes 80/20, which means Medicare is going to cover 80% of the eligible expenses. Your secondary insurance is going to help you with the 20. So Medicare's Part B is going to pay 80% of your surgeries, 80% of your labs, 80% of your doctor visits. Your secondary insurance will help you with the remaining 20 once the 240 is met. And it's varying amounts for covered preventative services. Some companies do a better job than others in helping you with preventive services, and we can discuss that at a later point when we get talking about insurance. but that is important to know. I'm sorry about that. And nothing in excess charges of the Medicare approved amount. Again, this is more in depth for something outside today, but certain facilities charge more than the standard charge. And again, that's more of a conversation for when you're ready to talk about coverages. So pretty straightforward for me. You pay 240, it's 80/20 the rest of the year. And unlike the Part A deductible, the $240 is once per year. Okay. What does Part A and B not cover? Now, some people don't understand this. It's important to know now. Everything in here pretty much has exemptions as Medicare does, but routine dental, routine vision, routine hearing, routine foot care. So dental's not covered by Medicare unless it's an emergency situation. You had an automobile accident, those kind of things, and it's got to be addressed. Vision, vision means for glasses. It doesn't mean if you had cataract surgery or those kind of things, that is covered by Medicare. They're talking just standard vision testing for glasses. If you're diabetic, that's not included as well either. Hearing, unless it's an injury to your ear, Medicare is not covering. And foot care, unless you're diabetic, your Medicare is not paying for any foot care for you. Long-term care, we talked about nursing home. Now, there's an important distinction here that when we talked at the very beginning about Medicare Part A and the various things that it covers, we talked about nursing home. But I did mention it's 30 days or less, like a rehab after a surgery, okay? Like um, you need help ambulating, those kind of things. It's called ADLs, activities of daily living. Usually, if you need help, let's say you're a single person after surgery, they'll help you with that to get you back on your feet so you can go home. Anything over 30 days is considered long-term care. Let's say you or a loved one develops Alzheimer's, those dementia, those kind of things, and they need to be put into a home, if you will, for help. That is not under Medicare Part A. Anything over 30 days is long-term care. An important distinction. Alternative medicine, Medicare does not do a good job of that. Acupuncture, those sorts of things, experimental medications, Medicare doesn't cover that. Elective cosmetic surgery, well, some things are considered cosmetic and some are declared surgical, and that becomes a little bit of a situation. If you have a mole that needs removed, you got to have your doctor declare it's not cosmetic. Personal care, any health care outside the United States, this is important to know. You go to Canada fishing, or if you go on a European boat cruise, whatever it is, anytime you leave the United States of America or U.S. territories, Guam, Puerto Rico, U.S. Virgin Islands, Guam, all those places are considered U.S. territories, and your Medicare is good. But anywhere outside there, you don't have coverage. Now, most insurance plans, the supplementals especially, do have coverage for outside the U.S. Travel. Prescription drugs, that's going to fall under Part D, which we'll cover in a little bit here, and any non-medical expenses. So it's important to know what Medicare covers, and it's also important to know what Medicare does not cover. So those are some of the things Medicare does not cover. Again, the healthcare pie, this will be the last time we see this. Again, I'll send you one. The doctor's office, labs, outpatient, durable medical, that all falls under Medicare Part B. So you can see we have unshaded areas. Technically, the pharmacy will be shaded in here, but they don't show this on here. But the rest of the ones that are not have any colors on them, you need secondary insurances for. All right, we'll talk about Advantage plans. Now, I'm pretty passionate about this particular item. I would happen if you decide at some point you'd like to sit down with me. I could go in a little bit more in depth, but what's an Advantage plan? I bristle at the part they call them Part Cs because it's really not part of Medicare. They call them Medicare Part Cs, but really what they are is privately run health plans is what they are. They're privately run health plans under Medicare's auspices, if you will. They're not part of Medicare. Here's important points to know. Once you're enrolled in an Advantage plan, you are removed from original Part A and B. Important to know. There's a couple reasons for that. First of all, you can't run the Medicare if you have a problem with Advantage plan because they have their own boards and things set up to talk about things. Okay. So that's important to know. Again, it's a private health plan. It's not supplemental insurance. Normally come with network restrictions, and the network can change from year to year. This is super important because almost all of them come with network restrictions, and a lot of networks do change. Optionally renewable every year. What does that mean, Dave? Well, they can decide to pull out of Rock County. Let's say you have a plan and they decide nobody is buying that plan. They're going to send you a letter. You have 60 days to find a new plan. They can drop out at any point. They just got to notify you. And if you join an Advantage plan, essentially you're doing this Medicare stuff every year because you got to sign a new agreement each year because they change the rules. Okay. Your out-of-pocket costs can change over time. As we all know with healthcare, it's not likely they're going to go down that much. But your out-of-pocket costs will mostly likely change in almost every one of these plans from year to year. The last part I think is the most important part. You can't buy secondary Medicare supplement insurance to cover those costs that aren't covered by an Advantage plan. Here's what I tell people. Your Advantage plan is your insurance. You can't buy insurance to cover your insurance, okay? And we'll cover this more in depth a little bit later if that confuses you. But there are two different situations. A supplement and an Advantage plan are two different things. All right, we're going to talk about Part D. D for drugs, everybody. It's pretty easy to remember. Prescription drug plan run by private insurance companies approved by and under contract with Medicare. Medicare really does not administer Part D, though run by the private health insurance companies. Medicare sets the rules, and then there's all kinds of drug companies out there. I think there's 5 or 6 major players, and I think in Wisconsin here we have 22 or 23 plans this year, and I'm not sure how many are going to be for next year. I might not know that till October, but and generally speaking, there's around 20 different plans under various companies. Prescription drugs only, brand name and generic drugs, of course. This line here, it may help you lower your costs, and that depends from plan to plan. I don't really like that line because drugs tend to be terribly expensive. And Part D does not cover non-prescription drugs, so your over-the-counter stuff, you will not get covered under Medicare. Weight gain or loss, fertility, cough or cold, hair growth, vitamins and minerals. So what's important to know under Part D for the most part is there's going to be lots of choices, and the choices really depend on the medications that you're on. It also depends upon the pharmacy that you like to use, because even the big, I call them the big boys, the Walgreens, the Walmarts, the CVSs of the world, don't take all the drug companies that are available to in Wisconsin. So if you like those pharmacies, you need to pick one of those plans. And if you happen to use a small town pharmacy, there are some towns around us that have a little corner place. They may only take 1 or 2 plans. So you got to make sure that you know what pharmacy plans or your plan will take, your pharmacy will take. Okay. Generic drugs are treated well under Medicare. Brand name drugs are not. Okay. This Part D, there's a big change coming forward on this as of January 1st. Probably almost all of you heard what's it called? Inflation Reduction Act 2 years ago in 2022, Inflation Reduction Act. They put a cap on Part D medications effective January 1st of 2025. So beginning here in January, they're going to cap your everybody's Medicare out of pocket at $2,000. But the important thing to know is we're not sure how the drug companies are reacting just yet. We should know here shortly in the next couple of weeks. We're not sure if they're going to omit some meds for the $2,000 cap or if they still have to cover what they covered. So it means they're going to increase their premiums. That is to remain to be determined. In theory, it's a good thing that there's a cap on there, but we're not quite sure if it's going to make the premiums explode or the copays explode. We're not quite sure on that, but it's coming pretty close because open enrollment's starting here pretty soon. The drug companies know, and the providers know, but us as agents don't really quite know, but we will know soon because all of our clients that are currently on Medicare will be getting their annual renewal notices, and it'll tell them what their new plan is going to be if they stay where they are, and the information will start to trickle in what all these plans are doing. So Part D for some of you will probably be the most expensive part of your healthcare. There's no getting around that. Some of you are on expensive meds. There are alternatives to almost all these plans. And again, that would be more of a question individually on one-on-one about your various meds to see what's going on there. But in general, all of you will need to have a drug plan. And if you don't need one, there's a plan out there. Let's say you happen to be on no medications. There's a plan called Wisconsin Senior Care, which is a state pharmacy assistance program, which would actually stand in the stead of one of these paying plans. Again, I could explain that to you. All right, we're going to start to wrap this up. Part A and B alone have no yearly limit for what you may pay out of pocket. This is why you have to think about secondary insurance, okay? Here's your options, okay, all of you. This is important. Original Medicare, For some people, they take Part A and Part B. They pay the $1,632 if they go in the hospital. They pay the $240 and they pay the 20% that Medicare doesn't. They pay it out of their pocket. That's called original Medicare. The most popular, at least in Wisconsin, is original Medicare plus Medicare supplement. What is Medicare supplement? It's nothing more than a vehicle to help you pay those deductibles and copays under Medicare. Medicare supplement lets you go any place that you want to go. It's very portable. Don't have to leave your doctor. It's a good deal. That's what that is. Or you can decide instead of original Medicare, you do the privatized, which is the Medicare Part C or Advantage plans. Again, most of those are network-driven plans. They replace the original Medicare and Medicare supplement with the all-in-one plan here. Okay. They are not the same. So prescription drug, Part D, we just discussed. Different options, different needs. So Dave, what does this mean? Don't compare apples to oranges. They're not the same. The important thing with your takeaway today is you're all going to get my contact information. It's important to know which camp you're in. You're either in the Medicare supplement insurance side or you're in the Advantage side or Part C, if you will. You have to know which camp you're in because once you made that decision, then most of the things that you get in the mail and the phone calls you get, you can ignore because I'm going to bet you that probably 75 to 80% of the mail you get and probably almost 90% of the phone calls are all the Part C plans. Okay. And the rest of the supplements don't bother you as bad. And the reason that the Part C plans do that, the marketing is because they're very lucrative. But that, again, that's a very different conversation than today. But different options, different needs. You just have to understand you can't compare a supplement to an Advantage or an Advantage to a supplement. They're completely different products. And a good agent should be able to explain to you the differences. All right. Everybody here is different situations. I'm a licensed agent. I can help you answer questions. And if you decide to meet with me, which I hope you might consider doing when you're ready to do so, we'll help you figure out the right solution. And again, it's the right solution for you, not the right solution for Dave. I offer a variety of products. Full disclosure, I offer Advantage plans as well. Sometimes that's a good situation. And for most people, I think the supplement's the way to go. But again, we'll meet one-on-one and we see what you need and we go from there. All on here. Okay, here's my card. I'm going to show you this last screen because I need to do that. Show you all the slides, all the riders and things here. But again, there's my card. I do work for Physicians Mutual, but I have my own company, and this is my company, Bomkamp Medicare Services. I'm here in Windsor. As Sheena can tell you, I'm in Janesville a couple days a week. I have I would say the bulk of my clients because when I started training with my trainer, Bill Lee, who was originally from Janesville. So my first clients came from there and the renewals and all my referrals would come from there. So I probably should have bought my house there, but if I was a little younger, I might have done that, but my grandkids are here. So that's it in a nutshell. The important thing to know is whether you decide to meet with me or not, take my number down. If anybody reaches out to you with a question you're not sure of, someone's trying to tell you that this is true and that something I told you today was not correct, or you just, hey, my cousin told me this, or my spouse or sister told me this, is this true? You can always reach out to me. If my phone is on from 7 in the morning till 9 at night, okay? 7 days a week. That's my personal cell phone. So if you have a question, please reach out to me. I'd rather have you say, hey, Dave, I was at your seminar. Is this true or not? I'll give you the straight scoop. I'm not going to try and force you into doing anything with me. I want you to have good information because we do this as a customer service, these seminars. We want you not to be taken. And I'm sure Sheena and the folks there appreciate that. We just like them. They take care of you. I would do the same. We want to make sure you don't make mistakes because Medicare, if you happen to choose the wrong product at the beginning, some of you will have a difficult time at the end switching insurance plans because of your health. So again, feel free to reach out.
Dave, we do have a couple of questions here at the end, and
Sure.
for any other participants that want to type in a question in the question and answer box, please do that now. The first one is, in what situation would you generally recommend a Medicare Advantage plan over regular Medicare plus supplement, I would think?
The main time that I would recommend that, and I'm brutally honest about things. The main folks that I put in the Advantage plans are those that are Medicare and Medicaid. It's called a dual eligible plan. They're on Medicaid. They're coming into Medicare. The reason an Advantage plan works is a couple. First of all, the state pays the deductibles and copay because all those plans have deductibles and copays. So the state pays that for them. Secondarily, with those type of plans, the folks on those plans get a care advisor, and most of the folks that are on Medicaid have health concerns, so they get a person that helps them with their health care and helps them get to the appointments and points them to advocates and stuff. So it's a very, very good plan for those folks. Sometimes I get someone that they had their spouse is already on it and they want it for the, the couple, the discounts and those sorts of things. Or I don't travel, Dave. I love my doctor. Then I don't really need the networks and stuff. And in some cases, that would be the case. But I would venture to guess that most of you like the ability to decide where you want to go for your healthcare, which doctors you want to see. You want to go to Mayo Clinic, you go to Florida in the winter, Texas, Arizona. Your plan goes with you. You don't have to worry about networks, those sorts of things. But that's the main folks that I put in Advantage plans.
Yeah, we share that opinion as well. So more unique circumstances for the Advantage plans, like you mentioned.
There's some niches, yes.
Some niches, right.
Mm-hmm, mm-hmm.
And then another question here, Dave, is the Part D plan required when you sign up for Medicare?
You will need to have a Part D plan regardless of you're taking meds or not. Now, most of you will be on a drug plan, if you will. Again, if you don't happen to take meds, the Wisconsin Senior Care, as I mentioned at the time, is really the best option for someone that doesn't take meds, or maybe one med and it's inexpensive at Walmart. You just pay cash for it. Because what happens is most people don't understand under Part D, there's a penalty for not having a drug plan, and it's 1% per month. So let's say, for example, you go to 70 years old, you've been Medicare 5 years. The penalty is 1% per month. Well, Sheena, that's 60 months, that's 60%. So let's say all of a sudden we're putting you on a $20 drug plan. Well, not only do you have a $20 drug plan, now you got the 60% penalty. So now you're paying $33, whatever the math turns out to be. And that penalty that you pay for the rest of your life. So you may not be taking meds now, and if you're lucky enough not to never take them, you're fine. But at least get the senior care in the event that you want to not pay for a plan. If and when you need a plan, then you jump off that. That counts as your insurance, and you're good to go. We want to make you remain compliant. Now, I have some folks that I'll just deal with it when I get there. I understand it's your money, it's your health care. You could do that if you want, but I would advise you, that'd be my professional advice, to make sure you have something at least to keep you in line with what Medicare rules are.
Yeah, and so just to clarify, Dave, that senior care plan is just kind of a workaround for people who
Yes.
really aren't for a drug plan, but
it's legitimate. It's legitimate though. Yeah. Mm-hmm.
Yeah, it's an inexpensive placeholder for you to then switch and go on to something else later.
It's $30 a year, so it's very inexpensive.
Yep. Great questions. Dave, thank you for being here. For anyone who wants to speak with Dave one-on-one, we're going to email out the recording of this presentation, the supplemental materials, and then of course Dave's contact information. John and I and the professionals here at Uncommon Sense, we're here to kind of start skimming the surface of Medicare as it relates to retirement planning, so we can be a resource. But we do often refer out to people like Dave to really help you shop and get into the nitty gritty of finding a plan and getting those questions answered.